My name is Dr. Dan Albrecht, one of the new family residents at Greenfield Family Medicine.
Hi, my name is Rachel Anderson. I'm one of the resident physicians here at Greenfield Family Medicine.
My name is John Romano. I'm a PGY2 at the Greenfield Family Medicine Residency here in Greenfield, Massachusetts.
Hi, my name is Masarama Haifeli. I'm a resident physician, currently PGY3 over at Greenfield Family Medicine.
I felt like they had a mission that I could believe in and that I wanted to be a part of building something, not just here, but building something with them. I think that's gonna be what ends up mattering to you when you're actually in it. And it's a lot harder to have that in the forefront of your mind when you're looking at where you wanna go, because you're gonna wanna go somewhere that has a name people are going to recognize. But that may not matter to you so much when you're actually in the trenches of it.
There were a lot of things that the Greenfield program did differently that interested me. I would say first and foremost is the faculty that we've kind of brought together here. Our faculty come from other great institutions, but what struck me more was really how they interacted with us as first-year residents. They're friendly, they're knowledgeable, they're really engaged in this program and in our learning. They've worked really hard to put this program together, and when we first showed up, it was really evidence that they view this as a culmination of their careers and their life's work, and they feel really strongly that this is important to develop. And that shows in the way they treat us. They treat us like peers more so than insubordinates or something like that. You know, it's not hierarchical. We go by the first name, and I think that's really unique, that this relationship we have with our faculty.
I felt like it aligned with a lot of my goals. Like, it's focused a lot on outpatient. They really care about physician wellness. They want to serve a community that really needs doctors. So I wanted to be in a place where I'm needed, and I felt like this was the place.
We really have one of the best wellness programs that there is. And part of that, I think, is that this starts with our scheduling. So it was built into the program. It wasn't an afterthought. Our schedules, we work minimal night shifts, minimal call, and really minimal weekends compared to other programs. So that kind of allows us to have that good quality of life to begin with, and that's, I think, kind of the foundation of wellness for most of us.
We have a designated counselor who can work with the residents when we feel that we need that, which is wonderful. Baystate has a system called Marvin, which is another way to get counseling support if that's the kind of support you need. Our program doesn't just pay lip service to the idea of physician well-being, it is built into our schedules.
You want to be laughing and have a good quality of life, and yeah, come join us and enjoy with us.
Anyway, I always tell people, you know, it's the best residency program in the country. I genuinely believe that. Look at the people you're talking to and decide if they're happy or not. Do you think they're happy? Do you think they are living in the things that matter to them, in their values and in their goals? And is the residency that they're in supporting them in doing that?
The best choice you could make would be to come here. Most programs are more alike than different, and this program really stands out as being different. And you know, that starts with the way the schedule was built to accommodate a good work-life harmony, and it extends into everything we do, the flexibility, the opportunities, and being located in a community that's really embraced us.
You see yourself as a leader. This is also a great opportunity to practice that, essentially, because we're still, you know, the program is still relatively new. So I think this is a great place to be able to be part of leadership and have an input in how a program should grow, and also what you would have liked the program to look like. If you're interested in shaping a program, this is definitely a place to be.
This was my number one choice, and it was a no-brainer for me at the time. Really wonderful clinical training that's broad in scope. You get an incredibly appreciative patient population that is just absolutely so thankful for having you provide their care. You get to be in beautiful Western Massachusetts, where there's not a lot of traffic, cost of living's a little cheaper than some of the other cities that you might have options doing residency in. Hiking at your doorstep, you've got great breweries, you've got all sorts of wonderful entertainment in the area, and then you have a program that really cares about your wellness. So I think when you put all those together, to me it was a no-brainer to come out here, and if I had to choose all over again, if I could rank this program higher than one, I would.